Imagine this, a piece of your skull held in your stomach for safekeeping. Modern medical techniques can be life-saving, and some not only reveal the ingenuity and knowledge that doctors use to save lives, but they can seem downright bizarre to the uninitiated. We'll meet Doctors Ritter and Orlowski, who are part of the team of doctors who treated a young man with a traumatic brain injury by using a surprising procedure that saved his life. Plus, we'll hear the story from that survivor, Sean McNamee, coming up next. Welcome to Up Close. I'm Kathy Unruh. Emergency brain surgery. It's a frightening ordeal for patients, but the quick response and surgical knowledge of doctors can be life-saving. Sean McNamee sustained a serious brain injury after an accident that took place at his high school. He was taken to Florida Hospital, Tampa, where he was treated for his injuries with what may seem an unconventional procedure. We're joined today by Dr. Ritter, a neurosurgeon and assistant professor of neurosurgery at the University of South Florida, and by Dr. James Orlowski, the pediatric medical director at Florida Hospital, Tampa. Both doctors played crucial roles in a medical team at Florida Hospital, Tampa, who treated Sean McNamee and saved his life. Sean, a junior at Wharton High School, is here to share his experience, and we want to thank you all for being here today. And very quickly, let's just touch on what your day jobs are. Dr. Ritter, what do you do at the hospital?
As a neurosurgeon, I treat traumatic brain injury, any type of brain pathology that needs surgical intervention, and any complex spine procedures or complex spine diseases that needs surgical treatment.
And Dr. Orlowski?
I'm chief of pediatrics and then director of the pediatric intensive care unit. So we take care of seriously ill or injured children.
And you know, when we think of pediatrics, a lot of us think of little children, but pediatrics extends to age what?
We go all the way up to age 21.
Okay. And Sean, when this happened, you were how old?
16.
Okay. Dr. Ritter, as a neurosurgeon, I'm sure you see a lot of serious brain injuries. What were the specifics of Sean's particular trauma?
Sean came in with a pretty significant injury. He had a combination actually of several types of bleeds that we encounter with traumatic brain injury. Most notably, there's two main types. One which is a type of bleeding over the covering of the brain. The other one actually is a bleed underneath the covering of the brain, which is called the dura. Sean actually broke his skull in a very dramatic fashion and sustained both an epidural and actually a subdural hematoma.
And that's as serious as the bleeding in the brain can get.
That's very, yes, that's as serious as serious can get, not to mention the fact that when you combine those two types of bleeding with his clinical exam, which is probably the most important part, that's as serious can get.
Sean, what do you remember of the accident that happened at school?
Oh, every step that I went through, pretty much. I was about to play football, and before practice we were just throwing the ball up, and I jumped up to go catch it, and my friend Daniel pushed, and then I went straight down, hit the painter for the football lines, and I got up really quick for some reason, and even though my skull was cracked, and just went to my athletic trainer, and he checked me out and stuff, and I left. Actually, I just got in my car and went home. My parents weren't home, but my sister was, and she was like crying right as I like opened the door. She could tell something was going on, and she called my mom. My dad came, picked me up, drove me here, or the hospital, and that's.
And I want to back up to a couple of things. This was pre-practice. You were not wearing a helmet.
Yeah, no helmet.
Okay, that's important. And when we say the painter, what we mean is a machine that was sitting on the side, so it was hard.
Yeah.
And after you went to your trainer, and when you drove home, did anyone know that you were driving home, or did you just kind of slip out and drive home?
Yeah, I slipped out.
What was your thinking then? Why did you drive home?
I wasn't really thinking too good at all. I was like mumbling, and I just did it for some reason. There was sort of got up and walked out.
You can probably help us understand why that happened. Was he consciously thinking logically at that point in time?
Actually, it's very hard to determine how well your thought process is. I mean, you clearly sustained a very bad injury to the brain, and people would definitely have have a very high index of suspicion that the thought process was not appropriate by the individual. So to what degree, at that time he was confused, it's very hard to tell. Obviously, as time went by, it progressed dramatically, worse and worse. But clearly, this was not a time that he was making appropriate decisions.
So the period of time between the actual impact and the time when, I'm not sure who saw him first, which doctor saw him first, what was that interim of time?
I'm not sure. I mean, he presented to the emergency room, at which point they got a CAT scan, and I was called.
Do you know, Sean, how long it was between the actual time of the accident and the time of arrival at the hospital?
30 minutes.
About 30 minutes.
Yeah.
And can we make predictions or assumptions about what would have happened if he hadn't gotten the treatment at the time that he did, if it had been any more delayed?
Yeah, he wouldn't have made it if it was any more delayed.
So he was pretty much at the wire there.
Very close, yes.
Sean, when you look back at it, what are your thoughts?
It was just an accident. It came to me, and there's nothing really I could do about it. I was in the air, so.
And were there any signs, perhaps, Dr. Orlowski, at the time with the people around Sean that the accident was more serious than maybe it appeared? And I'm not sure how his head, physically looked at that time. Could you physically see that it was cracked open, and was he bleeding?
No, there wasn't any external signs of trauma, but he had neurologic signs that suggested there had been an injury. How significant was not known until the CAT scan was done, and amazingly, about half of his brain was taken up by blood.
So why did your sister cry when she saw you at the door? What did she see? Do you know?
Because I started mumbling and stuff, and she started freaking out.
Oh,
about,
she knew it wasn't you.
Yeah,
something was wrong.
Something.
Why are time and treatment so critical, that treatment happens quickly with this kind of injury?
In Sean's case, it's very similar to what Dr. Orlowski said. Time is brain. And if we would have waited longer, Sean probably would not be with us today. So the quicker you can decompress the blood clot, the quicker you can remove the pressure from the brain, the better the outcomes are going to be.
And people are going to wonder, and so we'll talk about it later, but let's just get right to it, because I know the folks at home are thinking, how are you now? How are you feeling now?
Perfect.
You feel perfect? Feel normal?
A lot better.
Getting ready to go back to school?
Definitely.
You're studying at home, but you're looking forward to getting back to school?
Yeah.
All right, now let's back up and take us through what happened with the doctors, the team of doctors, the whole procedure, the coma, the decision to implant the skull in the stomach. Tell us how that whole medical thing went.
So I'll start, because I think I was, from between the two of us, I was the first one to see him. I was contacted by the emergency room that there was a young kid that had a very large bleed in his head. I've asked the physicians to immediately intubate him as they were in the process. They were able to describe to me some of his clinical exam, and that definitely made the decision to intubate very quickly.
Why?
Because his exam was deteriorating, and he was deteriorating rapidly, so his ability to protect his airway was very, very compromised. Not to mention the fact that some of the maneuvers that we can do immediately to try to alleviate the pressure can be done with the ventilator. At that point, I was actually driving in as I was giving orders as far as what to do, and I was calling the operating room to get a staff ready to take him immediately to the operating room. I remember seeing his parents, and I told them that I'd love to spend some more time and discuss the procedure with them, but time is really of the essence. And as I was talking to them, the staff was taking Sean back to the operating room. Once in the operating room, again, everything was done extremely quickly. The normal procedures that we take as far as trying to make sure that everything is done appropriately. And in case of an emergency, some of it is waived because time is of the essence. Once his skull was opened, and once the flap was performed and the pressure was off, at that point we actually were able to take a time out and pause. At that point, the emergency was over for a lot of the, for all intents and purposes. The
emergency, oh, sorry, you're going to tell us. The emergency was over because the pressure was
The pressure was off, the blood was evacuated, there's no compression on the brain anymore. At that point, we can start pausing and thinking, okay, what else needs to be done here? At that point, everything else, so everything, the point of doing everything was single. Remove the pressure. Everything else is secondary at that point. Once that goal was achieved, then we go and start looking at what's the next step here.
And was there a consult, I'm sure, in the operating room? How big was the team of doctors? Were you in the operating room as well? Okay, and how was it decided to let the brain, I'm going to say breathe for lack of a better word, for a while, and put the skull in the stomach for safekeeping?
It's a clinical decision. I think it's based on experience, based on how the brain itself looked when you're in the operating room. Brain typically swells between 3 to 5 days after the injury, just like your knee, just like your elbow. When you get hit initially, it doesn't swell as much, but the next day and the day after, you really notice that you really have done something to yourself. Brain's very similar. So you know that at this point in time, you've won battle number one, but the war is really yet to come. And you knew that you're going to be facing with a significant amount of swelling, especially in young kids. Therefore, the best way to do it, the best way to treat him is just allow the brain to swell. There's medications that we can give and other maneuvers that we perform, but the ultimate way of alleviating pressure is just to remove the confinement of the brain. And with a young kid, you really want to give them every chance that they have.
So what would be the impact of the brain swelling and then not, well, in other words, what were the complications that could have occurred for him down the road if the brain had swelled and then not come back down?
The brain is located in the skull. The skull is a fixed compartment. Though the skull is ideal for protecting the brain, in other situations where the brain swells, it starts pushing and shifting different parts of the brain, and those parts can be damaged and can lead to death.
So what made Sean a candidate for taking the skull in? I think because you had to relieve the pressure. But what other options would there have been for preserving his skull? Does it have to be implanted in the patient's body?
This is called the craniectomy, which is basically removal of the bone. You have different options at that point. Some places have a bone freezer, and you can actually implant that in the freezer. You wait the X amount of time, and it really varies between a month and sometimes 9 months that they go home and they go with a helmet, at which point when their brain is ready, and it really is an issue of when that brain is ready to accept that skull back, when the swelling is completely subsided, that you can implant that bone back. In Florida Hospital Tampa, we did not have a bone freezer, so you need to find a secondary suitable location. The abdomen is actually a fairly convenient location, and I guess I should be a little bit more specific when I say abdomen. It really is underneath the skin around the fat layer. It's not really in the stomach itself, but just under the skin between the fat and the muscle.
So Sean, tell us the first thing that you remembered in the hospital, when you remember waking, how you felt, when you learned what was going on with you.
Well, I woke up a handful of times, actually, and the first time I actually remembered the whole waking up, I looked right and left at my parents. That's the only part I remembered, and started using quite the mouth and freaking out, I guess. And I could barely talk. Just I don't know, that's pretty much all I remember waking up to.
Yeah, he lost more than a week in there because we had him in induced coma for over a week to try to keep the brain swelling under control and to try to make sure there were no complications. So the first thing he remembers is after we extubated him, which was way beyond a week of being in the ICU.
Extubated meaning taking
the tube out of his mouth. Right.
So he wakes up and he feels like, I have a really sore throat and I don't know where I've been for a week, and where am I, and who are these people?
It was so great to hear him talk because we'd had him in coma for over a week. And so as soon as we took the tube out of his mouth, he started talking, which was a very good sign.
And why did you make the decision after a week? What was it, because of the size of the brain? The swelling had gone down sufficiently?
The way Dr. Ritter left it, we could tell the brain swelling just by touching him on the scalp, and we could feel how much the brain was swollen. So once we had it under good control, then that was the time to go ahead and get the tube out and get him out of coma.
Now this is a little bit graphic, but I can see your scar. It looks like a part running down your hair, and it's going to be covered over. But is that exactly where the skull was fractured, or did you?
No, this is the size of the bone defect that I created for him. This is the area that allowed that brain to swell. You want to make sure it's very large, allowing more brain to swell. The actual part that was fractured is actually in the middle of that piece of bone that I removed for him. And actually, when we put the bone back on, we actually put a titanium plate exactly where that part was broken. To add one more thing to what Dr. Orlowski was saying, the other very important and beneficial part of hearing Sean speak was the fact that Sean suffered an injury to the left side of his brain. Sean is a right-hand dominant individual. The left side of the brain is what we consider the dominant side in 100% of right-hand dominant people, and 85% of left-handed. And that left side is really the area that allows us to communicate, express ourselves, and understand. So an injury to that part of the brain can be extremely debilitating for a young individual.
So to hear him speak
it was a very, very good omen.
Music to our ears.
Yeah.
It was what?
Music to our ears.
Yes, yes, and no matter what he was saying, right?
Yeah, I had a few choice words at that time.
When he said, I started mouthing up. Were you angry?
I honestly, this guy didn't really treat too well for quite some time in the hospital because I didn't know who he was, what happened. I was just, every time I would see him, he'd be asking me something, snapping at me because I wouldn't be paying attention. So
you were a little PO'd.
Yeah.
You're like, here I am, and you guys are like making me do all this stuff and answer your questions, and what's going on? Was that sort of what was going on
Pretty much.
with you? Okay, now back to the thing that most people find most fascinating, which is putting the skull into the abdomen, the fat layer. Thank you for that. When did that procedure become, is it common? When was it developed?
I actually tried to look up where it originated, and I wasn't able to find the exact individual who started this procedure, but it's a fairly common procedure that we do. It probably fell out of favor a little bit with the, as people or hospitals started having a bone freezer, because it's an incision that patients don't have to deal with. But it's definitely something that's been done for quite some time now, and fairly common for people that really want to try to alleviate the pressure to remove the skull and allow that brain to breathe, so to speak.
So Sean, once that was explained to you, once you began to comprehend what happened, what was it like to feel that? Did you, like?
Well, it's a funny story, actually. I didn't even pay attention to this. I just thought my stomach was like really hard for some reason right here, like something happened to my stomach, because it was puffy up here. I'm not thinking, oh, my skull's in my stomach or abdomen. But yeah, so like it was a while until I actually learned what it was and why it was in there. It was way down the road. It's like 2 weeks after or before I was leaving.
And I just am projecting personally, but I think if I knew that piece of my skull was down there, I'd be constantly like, wow, what's that feel like? And that's kind of weird. And yeah, knock on your head. Were you doing funny stuff like that? Was your sense of humor intact at that time? How about his healing tract? Was he pretty much on schedule for what you expected, or how these things go?
You always hope for the best and expect the worst, and he did miraculous. I mean, he was up and sitting up in a chair the next day after the tube is out. He's up and starting to walk with physical therapy and speech therapy and occupational therapy, working with him, and he was making amazing strides.
And you really didn't know until
we had no way of knowing until we took him out of coma what it was going to be like.
And during the time of the coma, was his head bandaged, or the brain just, how was that?
No, it was bandaged, yes.
Okay. And then I think you wore a helmet for a while after that, a protective helmet. And how long were you in the hospital?
22 days.
And when you got out of the hospital, what happened?
I went to go see my chameleon.
You went to see who?
My chameleon.
Your chameleon? Your pet chameleon that you'd miss the most of anything?
Exactly.
Okay. And right now you say you feel perfect. What's the medical assessment of how Sean's doing?
Yeah, he's probably 90, 95%. He's got a little ways to go, but not much at all. he's made a pretty miraculous recovery from this whole thing.
And you've used the word miraculous a couple of times. So was there anything in particular about Sean as an individual or a physical specimen or anything that helped him be this miracle? Or?
Well, he was young and healthy. He was an athlete, so that was a big bonus for us, a big plus.
And then, of course, we had a marvelous neurosurgeon.
Absolutely.
Okay, and we should say there was a team of doctors.
Absolutely.
Who included, what all sorts of doctors were?
I think one of the biggest advantages that Sean had was what you just said, a team of doctors. It's not just a single individual that really had to do with his success. It's the intensivist that played a critical role with everything that's after surgery. It's the neurosurgeons at USF that really worked hard, not only during the operation but afterwards. It's the neurologists, it's the infectious disease doctors, and then not to mention the nurses, the physical therapists. He had a team that really worked to make sure that he has the best outcome that he can have. So it was really just a global team effort, and that's probably why people do much better nowadays, because it is a combination of everybody pushing and everybody putting in their expertise. Everybody has something that they are better than everybody else, and when you combine that for the benefit of the patient, positive outcomes usually occur.
And I know you feel really positive. You're looking forward to going back to school. You're a junior?
Junior, yeah.
At Wharton High School. Do you see any football in any fashion in your future? I mean, even, sitting on the bench, anything? Dr. Orlowski's answering for you. I don't think Dr. Orlowski's going.
He can play video games, Madden 2000 or whatever that is. That's as far as the football will go.
But in any sense, I mean, will you miss your buddies on the team? Will you want to hang with them? How will that go?
Yeah, that's the thing that kind of ruined how I actually felt. They didn't even have to tell me that I wouldn't be able to be playing football anymore. I've been playing football since I was 6, 7 years old.
Now, I got to think, though, that maybe you don't really want to play football anymore. Am I wrong?
Why would I want that?
Why would you not want to? Maybe to save your brain?
I don't know.
Well, you did one thing that's really magnanimous, and for a young man in particular. After your recovery, you went back to the hospital to thank the doctors and everybody who had helped you. Tell us why you did that and how you did that.
The way they would treat me and help me out for 22 days. And I can't imagine having to just go back and forth with vitamins and food every day. I feel like that would be a long, 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 long day. Doing that, and they were all really good to me and always happy.
Everybody got very attached to Sean. He was still a very personal person after the injury. Sometimes that gets lost, but not with him.
Well, and you saw some changes in Sean, too. If he woke up kind of like a not real happy guy, and then he began to understand and he became a happy guy. So you sort of had some growth in your relationship while you were in the hospital. And did you kind of want to go back and say, I remember who I was when I first came out of that coma, and now I understand?
Yeah, and quite the terrible thing that happens to me now is I basically don't have a filter for my brain, and everything I say or want to say comes out, and I'm just nailing everyone. And I'm just like, I wasn't supposed to do that. Apologize and just forget about the.
I think I'm going to start using that. Oh, excuse me, I had a brain injury, and I just say whatever I feel like. I mean, that's going to be a bonus through life there, Sean.
I don't know.
I know. I understand you trying to work on that.
Yeah.
Now, how does it feel as doctors to have a patient come back and say thank you?
It's great. I mean, it's one of the nicest things you can have happen is a good outcome, and the patient realizes it, and patient and family come back to thank you. It's very nice.
I couldn't agree more, 100%. I mean, it's always nice to be appreciated. We work hard, and we do our best. Sometimes the results aren't as miraculous, but we put just as hard effort into every patient that we see. We really want the best, so it really is very special.
And Sean, what are your personal goals? I'm joking about it, but do you hope that you learn to filter better?
Oh, yeah.
What do you hope? What do you hope for your life as you go forward?
That's something serious I need to work on, actually. But
college, career, who knows yet?
Wherever my brother is going to college, I'm trying to follow. I mean, I've 3 years together at a college, and he's smart. He's really smart, and he would help me out a lot with the work I would have to do, because I would imagine that college isn't the easiest thing to go through, so I'm probably going to need someone.
Well, that'll be great. Thank you for being here. Doctors, thank you for joining us. It's a fascinating story and a wonderful outcome. Glad to hear it. To learn more about Florida Hospital Tampa, including the innovative procedures that are offered, you can visit floridahospital.com/Tampa. This episode of Up Close may be viewed in its entirety at wedu.org. Thanks for watching. I'm Kathy Unruh, and I'll see you next time on Up Close.